Borderline personality disorder has made a lot of headlines recently due to the recent Johnny Depp and Amber Heard trial. Amber Heard is quoted by a psychologist, Dr. Shannon Curry, as showing symptoms of borderline personality disorder. But why is this significant, and how does it relate to domestic abuse? To learn this, we need to take a dive into the disorder. Borderline personality disorder, also known as BPD for short, is a personality disorder in the Diagnostic Statistics Manual of Mental Disorders. This is also known as the DSM-5. To be diagnosed with borderline personality disorder, a patient must reach 5 of 9 criterias. I will be explaining these 9 criterias and cross-referencing it with the Amber Heard and Johnny Depp case when possible. Fear of abandonment can feel many different ways for a borderline. It can be literal abandonment, such as a partner leaving, and it can be emotional abandonment, such as feeling undesirable, not cared for, and disregarded. A borderline may feel like this even if there is no such evidence for abandonment to take place. This fear of abandonment can often cause them to act in ways that causes this abandonment to happen. For example, they may be in a relationship and this fear of abandonment may arise in them. This can provoke a very emotional reaction in the borderline. The partner of the borderline may become very confused as to why the other partner thinks like this and can cause further arguments. Because of this, the relationship can become exhausting and the partner is most likely to leave. This further permeates the belief of the borderline that they are right in thinking that they are going to be abandoned. It's a perpetual and torturous cycle of which they struggle to escape. A fantastic example of this intense fear was caught on audio where Amber complains that Johnny leaves a lot of the time when an argument is beginning.
But if you keep halting
I'm not doing
this and continuing
I'm
with
not
the rhetoric,
continuing it. I'm begging you to stop.
I don't. Okay, stop. I'm stopped. Stop. Now I have to go. Okay? So we will speak to each other in a couple of hours. Okay? I hope you have some kind of revelation makes you feel better. You know? I hope I do too. But we'll just see when I get home. We'll just talk, or we won't talk, or we'll finish this, or we won't finish it. But this is not love. This is not happiness. This is not.
Please stop doing this. Please, it causes so much fucking stress. I'm gonna die at this age. I'm gonna fucking die. You're causing me so much stress. Please stop. Please, I feel like I have a heart attack almost every day. Please stop. Please stop doing it. Please stop. He's so fucking mean.
Why are you with me?
Bully. Stop. Please stop. I've been begging you not to fight. I just said, can we please have a normal argument? Just even a normal conversation, fucking normal argument. And for the last hour, I've been begging you to please just leave it at that. Let's just go on with our night. I would have been able to come in with you. We would have been able to let it go in a few minutes. It would have been fine. It would just, if we allowed ourselves to have fucking normal arguments. Please, you're killing me with this. You're killing me. You're fucking killing me. Man, fuck.
Sean, could you, please, I want you to just go. I want you to take your medicine or whatever. I'm sorry that I've upset you.
Yeah, I think. Thank you, Sean. I'm ready to go. Thank you so much.
This fear of abandonment can often lead the borderline to engage in manipulative behaviours in order to prevent abandonment from happening. An example of this can be self-harm to gain affection, which we will cover in a later criteria. In the context of a relationship, it is easy to see how a relationship can turn abusive due to fear of abandonment. Relationships that are driven by fear can cause the borderline to engage in behaviour known as trapping. Trapping stops the victim from leaving the relationship by tethering the person down with perceived responsibilities. These can range from pregnancy to financial ties and even threat of suicide. To understand that what a borderline fears the most is abandonment is key to deconstructing their behaviour. Borderlines in interpersonal relationships can be challenging. One thing they may suffer from is something called splitting. Splitting can be described as intense idealization of someone, followed by extreme devaluation. This can be triggered by an emotional disturbance. For example, they may be in a conversation with a loved one, and they are getting on well, and then the person they love disagrees with something they say. In a healthy relationship, you can disagree, but still love the other person. However, from a borderline's perspective, their perfect perception of what the person is has just been shattered, and they cannot reconstruct the world to suit that. This is why relationships can be intense. Sometimes you can seem like their favourite person, and that they love you and treat you with great affection. And it's a real emotion. Borderlines are not lying when they feel this towards you. However, in the devaluation phase, it can often feel like they bear a lot of resentment towards you and even hate you, and may even say that. It is partly why being in a relationship with a borderline is so attractive, because when they idealize you, it can feel like no other kind of love. It's intense and, in biological terms, is a drug, and the devaluation phase is the come down or the hangover. I personally believe that if maybe you lacked affection from a caregiver growing up, you're more susceptible to be in a relationship with a borderline, purely because the affection that they can offer you can often compensate for that loss. Because borderlines feel emotions more intensely than others, the high of engaging in risky behaviour is so great that they can often forget about the consequences. These impulsive behaviours can manifest in many different forms. These can range from drug use, unsafe sex, impulsive spending, reckless driving, binge eating, self-harm, changing appearances permanently, such as tattoos or piercings. And whilst that can be an impulsive behaviour, it's more related to issues with identity. It can also manifest in shutting people off completely without warning. The behaviours are a lot like what you would see in the manic phase of bipolar. In a relationship, it can often be stressful to have a partner suffering from an addiction. There is also the risk of infidelity, but there is limited research on this. However, this impulsivity can also be attractive and can draw people into relationships with the borderline. Sex can be spontaneous and exciting. The energy a borderline can give off can be intoxicating and a thrill to be around. It can come across as adventurous. The impulsive behaviour can also be used as an escape to escape intense negative emotions a borderline may feel. It is contested as to why a borderline may engage in self-harm. Some may say it is a way for a borderline to feel something and can provide brief emotional relief. It can also be a form of self-punishment from overwhelming feelings of guilt, and can also be an act of manipulation in order to receive attention they may have perceived to have lost. The most common method of self-harm is cutting. I would argue it's due to its non-lethal nature, plus the combination of shock value it can produce. Most people who follow through and actually commit suicide tend to be men, whereas women are more likely to have a suicide attempt. Most people who are borderlines are women, and therefore a non-lethal method of self-harm as being the most common makes sense. Self-harm can elicit feelings of guilt in a partner. This may be intentional or unintentional. Sometimes the emotional response a borderline may receive can reinforce the cycle of reoccurrence. If they crave that emotional response, they will engage in it again. And that's what makes it so tough to break away from that behaviour. Borderlines are extremely sensitive to emotions and seem to be more affected by them. This extends to both positive and negative emotions. Because of this, a borderline may not respond well to criticism or perceive valid criticism as a personal attack. This can make a borderline difficult to work with, which I will discuss later when we talk about potential treatment. A borderline may also struggle to concentrate on academic work through being distracted by overwhelming emotions. This can stem from reliving an uncomfortable memory. The intense euphoria a borderline has can often be followed by intense dysphoria. And one of the things that can categorize this dysphoria is feelings of victimization. Tying this into the Johnny Depp case, Amber Heard consistently claims to be a victim. Victimization can be a way of rationalizing the intense emotional reactions a borderline can have. It's tough to recognize that you might have a role in tempering your own emotions, so it's easy to blame others for your own outbursts. A person with borderline personality disorder may suffer from a distorted sense of self. They struggle to understand who they are, what they believe, and how to establish a stable identity. Because of this lack of a stable identity, it can be common for a borderline to frequently radically overhaul their appearance. This can be done through different haircuts, colouring hair, and tattoos. It can be the way they dress or even the way they act. They seek to establish an identity by consulting the external world to fill that identity, though this may also cause them to lack purpose and be driven towards radical ideologies and sometimes even cults. By seeking this validation of identity from the external world, it can often prove futile and leave the borderline just as empty as before. Just this time, they have permanent body modifications that they may suddenly decide not to like. Both partners in a relationship need to have a stable identity, so when you're negotiating, you both know where you stand. If one believes something one week, then something different the next, it can be difficult and sometimes even impossible to negotiate. A strange phenomenon is that borderlines can sometimes base their appearance on others as a means of establishing that sense of self. Whether Amber Heard dressed similarly to Johnny because of this, I do not know. It's hard to establish that from clickbait sensationalism. As stated before, this lack of sense of self can often lead to feelings of complete emptiness. This can lead to radical actions being performed in order to feel something. As discussed previously, this can tie into impulsive behaviours and self-harm. In a relationship, borderlines can often report on average a decreased satisfaction in relationships. This may also be further perpetuated by idealization of your partner and the idea that your partner needs to fulfill all of your needs, and if they don't, they are radically devalued. One of the consequences of feeling emotions more intensely is that this also extends to anger. It is important to understand that not all borderlines express this anger physically or verbally. Sometimes this anger can be bottled up out of shame or guilt from maybe previous outbursts they may have had in the past. This anger can also be directed at oneself and may be a further reason to self-harm. Unfortunately, though it is often thought as stigmatic, individuals with borderline personality disorder can express this anger through physical abuse. We know so far from the trial that Amber has admitted to hitting Johnny in the following audio tape.
I'm sorry that I didn't hit you across the face in a proper slap, but I was hitting you. It was not punching you. Babe, you're not punched.
Don't tell me what it feels like to be punched.
You know, even a lot of fights been around a long time. I know.
No, when you fucking have a closed fist.
You get punched. You got hit. I'm sorry I hit you like this. But I did not punch you. I did not fucking deck you. I fucking was hitting you.
You can't
I don't know
deck
what
me.
the motion of my actual hand was, but you're fine. I did not hurt you. I did not punch you. I was hitting you.
Oh,
That's
you-
the difference
you
between
poor
me and
dog.
you. You're a fucking baby.
Transient stress-related paranoia is paranoia that can happen briefly depending on the situation. It comes and goes and can be triggered by emotional disturbances. This paranoia can often produce the feeling that people are secretly plotting against you, or maybe a partner is being unfaithful. In Abba Heard's case, these would allegedly manifest in perceived slights, reading negative intent into another person's comment. For example, imagine you compliment your partner and say, "You look nice today," and they say, "Do I not always look nice?" and believe that the intention of that comment was to hurt them. A response like this may also depend on the borderline's emotional state. If they are in a good mood, they might respond in a positive manner. It is also this inconsistency of not knowing what to say that can make a relationship with a borderline difficult. To establish a stable relationship, you need to find common ground on what is acceptable to say to each other and what is not. If that is shifting back and forth, it puts stress on the relationship. It's important to know that not all borderlines act this way in interpersonal relationships. Some are exceedingly self-aware and seek treatment. However, a personality disorder is not something that can be cured. It is not an illness. There is one option for treatment that has been shown to put borderline personality disorder into remission. This is called Dialectical Behaviour Therapy. DBT is defined by 4 modules: acceptance and change, mindfulness, distress tolerance, and emotional regulation. The therapist aims to be an ally for the patient and take them through each of these 4 modules. This method of therapy has been shown to put BPD into remission for 73.5% of inpatients suffering with BPD over a 6-year period. The fact that these patients are inpatients shows that it is very promising for even the most extreme manifestations of this disorder. However, whilst some can be put into remission in as little as 2 years, it is a very long process. The relationship that a patient has with a therapist is the most important aspect. This is why agreeableness is a trait that can predict whether this therapy works, as those high in agreeableness are more likely to cooperate with the therapist. People with BPD can often be difficult to treat, as it can be easy for patients to become defensive and devalue their therapist. This can be stressful for the therapist, and because of this, many professionals can sadly refuse to treat people with this disorder. Because it's such a long process, it is also a very costly method of therapy. For this method to be effective, you have to be ready to improve. You have to be aware of these issues and devote a large portion of your life to it. But the fact that this can help is a very beautiful thing. To know that it's not hopeless, and ultimately you decide whether you can be helped or not. You're in control of your own actions. There's lots of resources available to help people with this disorder, but what about the people that are left in its wake? The children who endured one or both parents with the disorder, or the partner that got hurt time and time again when this disorder manifested itself in the one they love. I scarcely see advice for these people, and they are often forgotten and left to pick up the pieces of themselves that were shattered by this person. So many times the responsibility falls to them. So what do you do? Do you take revenge? Do you ignore it? I believe you should forgive. It's the only escape from negative emotions you may feel from this experience. Understand the grey nature of the world. The ones that are capable of the deepest love can commit the worst type of harm. To bear this knowledge and open yourself up to the possibility of being hurt is what love is. to dive headfirst into that abyss and say, yes, I was hurt, but that doesn't mean everyone is like this. You cannot change other people. You can only look inward. What was it that drew you to this person? Was it circumstance? Was it how they idolized you? Perhaps there is something inside yourself you could acknowledge to decrease the possibility of it happening again. We all have work to do on ourselves, work that we will probably be doing until the day we pass. But that's how existence works.